Laser technology has helped millions to see the world clearly. And if you're considering laser vision correction, this video will educate you about laser vision correction and the individualized approach taken at Vermont Laser Vision at Timberlane's state-of-the-art facility.
Laser vision correction is used to treat nearsightedness, farsightedness, and astigmatism. And the vast majority of people have optical aberrations in their eyes that result in their particular glasses prescription or contact lens prescription that is within the range of what is approved for treatment by laser vision correction. At Vermont Laser Vision at Timberlane, we specialize in laser vision correction, specifically LASIK surgery and LASEK surgery. LASIK surgery is a procedure where a flap is made in the cornea and the laser treatment is placed underneath the flap in a structural layer of the cornea called the stroma. LASEK surgery does not involve a flap, and the thin surface layer of the cornea called the epithelium is removed, and then the laser is applied directly to the surface of that deeper structural layer. The main difference between the two procedures is short-term in terms of recovery, because in the long-term outcomes are comparable in terms of visual quality. Some patients may be better candidates for one procedure or the other, and one of our goals when we assess a patient is to determine which procedure is most appropriate for you, if any, and would you be a candidate for either one, and then tailor that choice to your own preferences and expectations.
So when I first met with Dr. McCormick, I was very impressed with his professionalism and his attention to detail. He's very kind in nature. His mannerisms, he shook my hand, he made me feel very much at ease, and I really felt that his experience, the way that he came across, his knowledge, it made me feel that I was in the right place, and this was something that was the right choice for me.
The first question most patients have is, am I a candidate? And once we've determined that, then the next question most people have is, are there specific things that I should know about that may be different than someone else I know who's had laser vision correction? For example, will they need reading glasses after treatment? Are there concerns about dryness, or are they more or less likely to reach their desired outcome than somebody else? And we spend a lot of time talking about the specifics of their situation and what's realistic, what are typical outcomes for someone like them.
I chose Vermont Laser Vision at Timberlane mostly because of Dr. McCormick's reputation. I have a family member that knows him personally, and he said everything here is great. The people are nice, the procedures are smooth, and I took his advice and it worked out great. My eyes were terrible before this, and I'd get up at night and could hardly find my way to the bathroom. After this, I'm able to get up, read the alarm clock, see what time it is, find my way around, and not have to worry about fumbling for my glasses or trying to put contacts in to do it.
When a patient comes in for a complete evaluation, there are a number of measurements taken to evaluate the shape of their cornea, which is the part of the eye where the laser treatment is delivered. That's the part of the eye where contact lenses sit on the surface of your eye. And then measurements are made of the optics of their eye, referred to as a wave scan, which is used to create what's called a customized laser vision correction treatment profile. And this is the type of technology that we use for the vast majority of our patients through this office. Now, once those scans have been done, another set of measurements are taken to verify the prescription that they need in multiple different ways, before and after dilating drops. And then finally, a detailed examination by me of the front and the back part of their eye to make sure that they're an appropriate candidate for laser vision correction in the first place, and if so, which kind of laser vision correction treatment would be most suitable for them. We spend a fair amount of time talking about those options and making sure that each patient knows what their choices are and makes an appropriate decision.
I chose Vermont Laser Vision of a recommendation from my eye doctor, Dr. McCormick was very informative about my procedure. He explained to me the proper levels that your eyes should be in order to be a candidate for the procedure. He explained some of the risks. He explained the percentage, hopefully, that I would have correction. He was very informative. I am more than pleased with the outcome of my surgery. I only wish that I had done it earlier. It was really moving to me the next morning when I opened my eyes after the procedure and I could see my alarm clock, which was on the other side of the room, without reaching for my glasses on the bedstand. So I was very pleased. I'm able to swim now and not have to worry about blinking my contacts out. I'm able to spend actually my driving at night. My eyes are a lot clearer. I can see leaves on the trees, so it's been great.
I'm Samantha, and I'm the refractive surgery coordinator for Dr. McCormick at Vermont Laser Vision at Timberlane. We are very fortunate at Vermont Laser Vision to have a fellowship-trained surgeon. In addition, Dr. McCormick has a variety of publications that are geared specifically towards the wavefront technology that's utilized during customized laser vision correction treatment. In fact, there are eye care professionals and eye doctors in the region who refer patients to Dr. McCormick because he's able to treat the more complex cases due to his fellowship training.
At Vermont Laser Vision at Timberlane, our individualized treatment is the key to our success. We will work with you to help you achieve your personal best vision. If you are ready to see the difference, Dr. McCormick is ready to see you. See the difference at Vermont Laser Vision at Timberlane.